I'm here with my good friend Eric Donnenfeld. Eric, you gave a wonderful talk, interesting subject, which is on the use of an agent that we use during surgery that is going to stabilize the pupil and make everybody happy. Tell me about it. Yes. I. So, shall I say that now?
Oh, I'm sorry. This is live?
This remains live.
Okay.
I want. Do you want to start it again? No, we're going live here.
Hey,
No, you just, I'm with the past president, but will forever be for me the president of ASCRS, Eric Donnenfeld. We're talking about an agent that we use during cataract surgery. What are we talking about?
Well, to start off with, when we as ophthalmologists perform cataract surgery, we perceive a successful result in terms of visual acuity. If the patient's been visually rehabilitated, we see that as a success. Patients view that as important, but they also view something else as important, and that is the experience. Was it uncomfortable? Did they have pain during or after the procedure? So we can have a perfect 20/20 result, and the patient may come back the next day upset and uncomfortable and say you didn't do a good job and just be very annoyed by the procedure. And that's because pain is important to patients. So what do we do to prevent pain during cataract surgery? Well, we use topical anesthetic, we use intracameral anesthetic, but there's a new drug called Omidria, which has been around actually for a couple years now, and it combines phenylephrine and ketorolac. Ketorolac is a very potent nonsteroidal that has analgesic effects, reduces pain, and this is the only time it's ever been put in the eye. And we found that it does reduce pain. In the FDA trials, actually, it significantly reduced pain. So in our trial, we randomized patients to having conventional cataract surgery with intracameral lidocaine and epinephrine versus patients who had intracameral ketorolac and phenylephrine in the form of Omidria. And in addition to that, they had lidocaine as well. And what we asked afterwards was, right at the conclusion of surgery, is how much pain did you have? And there was a clinically significant reduction in pain in the patients who had Omidria. And as a matter of fact, patients who had pain during the procedure were asked to say they had pain, and then they were given fentanyl opioids to control the pain. And what we found was that when you used ketorolac, there was an 80% reduction in the use of opioids during cataract surgery, again with the use of Omidria. In this day and age where there's an opioid epidemic and we want to keep our patients comfortable and happy, I think this is an important study showing that the use of Omidria reduces pain and reduces the need for fentanyl opioids during cataract surgery.
Now, this is a medication that's actually put in the irrigation bag, right? I mean, this isn't anything that a surgeon has to participate with.
Right. This actually goes in the bag, just as you said, injected at the beginning of the case. It's a pass-through product, so it's covered by Medicare. There's no cost to the patient in general. And the patient has less discomfort. But in addition to that, the other studies have shown overwhelmingly they have better dilated pupils, they have less inflammation post-operatively, and the procedural times are faster with less complications. So it's a win-win.
And I mean, I realize that as ophthalmologists that we use many things off label, but just I mean to make that point, this is on label for intracameral use as opposed to the intracameral medications that we currently use, which we're using off label.
This medicine has been investigated. It's gone through phase 2, phase 3 FDA trials. It's been approved by the FDA. CMS has recognized it as a pass-through and that it's an innovative drug. And the indication is the reduction of pain and maintenance of pupillary mydriasis. So it's right on label.
Do you use it with all of your patients, or how do you pick and choose? Or?
I use it on all patients where the insurance covers it. I don't want to charge a patient for something.
Right.
So for Medicare patients, it's covered, and then for some private insurances now as well.
This is great stuff, Eric. I want to thank you for bringing this to us. This is really not anything that involves. I mean, there are so many things that we do in advances in surgery that involve some sort of learning curve. There's no learning curve here. It does its thing, and you do your thing.
Couldn't agree. And I enjoyed doing my thing with you here today, Josh.
Oh, gosh. Anyway, thank you very much for the generosity of your time with us.
Thanks, Josh.